Chapter 28, Child, Older Adult, and Intimate Partner Abuse. So family violence, the definition from your book is intentional intimidation, abuse, or neglect of children, adults, or elders by a family member, intimate partner, or caretaker in order to gain power and control over the victim. So 46 states in the United States have specific definitions of family violence in their state civil statutes. So the types of abuse, you have physical abuse. This can be any kind of pain, causing pain or physical pain and any bodily harm. So slapping, punching, hitting, choking. Sexual abuse, this is any kind of sexual contact without consent or in the circumstances of when the victim is incapable of giving consent. Emotional abuse is the infliction of mental anguish, so threatening, humiliating, intimidating, and isolating. Neglect, the failure to provide for physical, emotional, educational, and medical needs. And economic abuse, this is controlling a person's access to economic resources. So we have the prevalence, half of all Americans have experienced violence in their families. Comorbidity, so the things that would happen due to the violence, so anxiety, depression, suicidal ideation. And if you look here below, you have that depression and PTSD are the two most prevalent disorders resulting from childhood trauma. That's something we've been obviously talking about and learning all the way through here. We're finding lots and lots and lots of mental illnesses come from, or there is some history of childhood trauma. Abused adolescents exhibit more psychopathological changes, poorer coping skills, higher incidence of dissociative identity disorder. Remember, we learned about that in class, and that is also, or used to be known as multiple personalities, but now it's dissociative identity disorder, and poor impulse control, so higher circumstance of abusing substances and things of that nature. Child abuse, so in 2010, 3.3 million referrals for child abuse, 20% which were substantiated, so that's 660,000 cases of substantiated child abuse in 2010. The most common abuse is neglect, so we had just talked about neglect, and make sure you read up again on that if you've forgotten. Prevalence of sexual abuse in children is difficult to determine because children are often unable to describe their experience. And what else? Well, how about that they're afraid? Hold on, I just flipped there. They're afraid to talk about their experience. They're afraid of getting their perpetrator in trouble. 80% of perpetrators are the victim's parents. So that's overall for child abuse, not sexual abuse, but overall for child abuse, 80% of the time, the perpetrators are the victim's parents. So we are advocates for children. Remember, I talked in class about how once you have that RN behind your name, you are now a mandated reporter, and that means for all of your life, every aspect of your life, not just as a nurse. Intimate partner abuse, so more than 1 in 3 women and 1 in 4 men have experienced some kind of intimate partner abuse. So the physical, it's either physical violence, rape, and or stalking by an intimate partner at some point in their lives. Intimate partner violence occurs at the same rate in hetero and homosexual relationships. And 1 in 10 homicides are due to spousal murder. So maybe you guys have heard me talk about how I like Investigative Discovery or Snapped. Those are some shows that I've always kind of been slightly addicted to. But if you notice, many times the murder that happens is by either a boyfriend, girlfriend, or a spouse. And for whatever reason, many times it's infidelity, but there's other reasons too, just like, maybe insurance money or things of that nature. So, older adult abuse, so 2 million older adults abused each year in the U.S. The statistics for this are actually much higher, as for every 1 case, 5 go unreported. Types of abuse for the older adult is physical, psychological, and neglect. So nurses must also advocate for the older adult, much like we do children. So again, that is something we are mandated to do for elder abuse. The only type of abuse in which we do not report is spousal abuse. So if and typically it's women, but that doesn't mean men can't be abused, because they can too. But typically it's women, and all we can do is encourage them to leave, give them resources of where to go, help them through the whole emotional process. But it would not do us any good to report. Police don't do anything because they're an adult and they've got to make that decision themselves. So perpetrators, the tendency for violence is typically rooted from childhood and is displayed by a lack of self-regard, dissatisfaction with life, and inability to assume adult roles. So most perpetrators have witnessed or experienced some kind of violence, neglect, or abusive parenting. A perpetrator can be any member of a household who is violent towards another member. So you could have sibling to sibling, parent to child, adult to adult, extended family members. So anybody can be the perpetrator. It doesn't necessarily have to be the parent to the child. It can be other ways as well. Characteristics of perpetrators. So they consider their own needs more important than the needs of others. So that would tie us back into our personality disorders we learned about in class, like narcissism or antisocial personality disorder. They have poor social skills, so relationships with their partners are typically the closest relationship that they have ever had. They have extreme pathological jealousy. Though controlling many aspects of the partner's life, abusers often accuse partners of infidelity. So though they know everywhere they're at, they know where they're spending their money, they've got all this control over the person and know what they're doing, but yet they still accuse them quite often of cheating and not being faithful. And may control family finances, so many times in such extreme ways that there's very little money for daily living. The cycle of violence, so you have a little diagram here for you. You're going to want to know these stages. So there's the tension building stage. This is minor incidents such as pushing, shoving, and verbal abuse. The acute battering stage, so this is where you're going to have the major beatings. There's going to be serious injuries. And then there's the honeymoon stage. This is a period of calm. Abuser shows love and kindness, initially feels remorse and is apologetic, but soon after no longer feels those things. And then it just keeps going back through. Then it goes back into the tension building stage. A vulnerable person is a member who is being abused by a perpetrator. The terms used for this are victim, survivor, or victim, survivor. Survivor recognizes the recovery and healing process that takes place following victimization. And the word victim has an implication of passivity. So it doesn't really matter how you refer to the person who has been violated, whether you say victim, you say survivor. Some people, it makes them feel better if they say survivor. It gives a little bit more control. But regardless, for us taking care of people who have gone through some kind of victimization, they are our patient, and we need to treat them as a victim, as a survivor, as both, because they have been violated, and we are going to help them move forward and survive the incident. Some more characteristics of vulnerable persons, so specifically women. Pregnancy may trigger or increase violence. The partner may resent responsibility baby will add, and may also resent the relationship that the baby will have with the mom. Nurses need to educate women and provide resources and assistance to help get them out of abusive relationships. So again, we don't report this, but we encourage them to make a break. Violence may escalate when wife makes a move towards independence. So like if the wife is going back to school, getting a job, going out with friends, you see without permission. Sometimes that's the reality for many women, that they have to get permission to do things. The greatest risk for violence is when the woman attempts to leave the relationship. So we build them up and build them up and build them up to get them out of the relationship, but then they're at the greatest risk. So it's a double-edged sword trying to get women out of these bad relationships. Children, vulnerable children, so typically younger than 3 years of age because they can't really communicate what's happening to them. Maybe because they're perceived as different. They remind the parents of someone they do not like. They can be a product of an unwanted pregnancy and the interference with emotional bonding between parent and child. So there's a ton of different things that can make a child vulnerable to abuse. And then older adults, if the older adult is in poor mental or physical health, if they're dependent on the perpetrator. So, for instance, I think, we're actually going to talk about that in just a second. Never mind, we're going to move forward. A female older than 75 years, white, living with a relative is the highest risk factor for abuse. But here's two circumstances that depended on perpetrator. So an elderly father cared for by a daughter that he abused as a child would be at risk, and an elderly woman cared for by a husband who has abused her in the past. So, those who are violators or were perpetrators in the past, it kind of comes back around. And many of us may initially have the attitude of, well, good, they deserve it. They did something bad to this person, so, they got karma. Karma hit them. But at the same time, we need to be objective about this, and we still have to care for people, even perpetrators. We care for perpetrators. So, assessment stuff. Okay, must establish trust with patient before focusing on details of the violent experience. I hope that makes sense. No one's going to want to open up about a rape or something of that nature before there's a rapport established. Interview guidelines. So you can see you have the do's and do nots. Please be sure to go through these. I'm not going to read through all of them, but please be sure to go through both the do's for interviews and do nots for interview guidelines. You can check out table 28.4, page 542. Diagnoses, nursing diagnoses, risk for violence, risk for injury. Reporting abuse. Nurses are legally obligated to report suspected or actual cases of child and vulnerable adult abuse. This is serious. See that? This is serious. In Michigan, failure to report can carry 4 years in prison and loss of nursing license. So it's super serious. Like, you have to do it. Competency with vulnerable adult must be considered. Over here you can see mandatory reporting of child abuse. It's the law. So when I wrote scenarios, we would have talked about this in class, but what are some things that you can see yourself where it's going to be a sticky or a hard situation? Well, I think we talked about it in class one point about what if a child, your niece or your nephew, comes to you about your brother or sister? I mean, it's going to be difficult. But if that child gets to the age of 18 and turns you in, and it's proven that you knew, you can basically kiss your whole career goodbye. So it's very serious. Prevention of abuse, primary measures. So basically we want to help with stress reduction, making sure there's social supports, increasing coping skills, self-esteem. Community health nurses are in good positions to help and follow families. Secondary, member screening programs. Secondary has to do with screening, assisting with caregiver burnout, especially for those caring for elderly, patients. And tertiary prevention, this is going to involve the nurse facilitating in the healing and rehabilitation process for the people. We're going to assist survivors to reach optimal level of safety, health, and well-being. And there's legal advocacy programs for survivors of intimate partner violence is an example of tertiary. So going and advocating at a legal level for survivors of intimate partner violence. Child abuse perpetrators are most often the child's parents. And should nurses be legally mandated to report intimate partner abuse? They are not, but maybe should they be? I don't know. That's not for us to decide. That was for our law to decide. All right, so that's it for this chapter. I'll get your next one done in just a few minutes.